When somebody comes in so early on from the onset of a stroke, we have the ability to give a clot-busting drug. People who get it, compared to who don't, have far less disability a few months down the line. The disadvantage is the risks of bleeding. So although it's good to break down the clot, in this world you almost can't have something for nothing. The risks of bleeding are lower than the benefit. The risks of bleeding are around about a few percent. And low.
The chance of developing serious side effects from the drug is less than 1%.
But there's no point. I can't say to you, it's all good. There's no problems. That's not fair. That's not the truth.
72-year-old Laura is being rushed to King's, having suffered a suspected stroke. Her husband Camillo is driving in behind.
I was down here in the kitchen, and she came down about around 9 o'clock, and she made herself a lemon tea. That normally I always take the lemon tea up to the bedroom. She went back upstairs to bed. After 10 minutes, I went upstairs to get ready to go out. I saw her standing in the bedroom, and I said to her, "Are you okay?" And she couldn't talk. She had a piece of paper and she wrote, "I think I have a stroke." Then I phoned the ambulance.
Stroke over here.
This is 72-year-old Laura. At 9:50 this morning, she's had sudden onset of slurred speech.
Hello, it's Laura, right? I'm Fiona, I'm one of the nurses. So your speech gone? Yeah? I know you want to say the words, but you can't, right? Yeah. Okay.
She must have been desperate to make people understand what she was feeling, but she couldn't.
Okay, it's gonna be okay. You're in the right place, all right? And we'll take good care of you. Yeah, is that what you were trying to say, your husband? Yeah. Okay, once he gets here, we'll let him know where you are, okay? And he can come. Yeah.
Jenny, I'm one of the neurology doctors.
Hi.
How are you? Don't worry, we'll try and look as to why that is, okay?
Doctors will scan Laura to find out if there is a blood clot on her brain.
Can you hand this leg up for me?
We've got a husband here. Shall I put him out?
No. It was terrible. You see somebody that they cannot talk things like that, you think always are the worst.
Laura is being rushed to the CT scanner to confirm if she's had a stroke.
Watch the cord there.
Thank you. Everybody ready?
We met in the city. She used to work in a bar, a wine bar. And I used to work in a snack bar, to work for the same boss. So I went there to see the boss, and I saw Laura at the door on the way home. She had a fantastic body, good shape, you know, like men like. And so I said to her, "Where are you going?" And she said to me, "I'm going home." So I said, "I give you a lift." I said, "With the bus, because I haven't got a car." And she thought I was a bit simple, and she went. A couple of years after, we got married. She was about 31. She was divorced. She had one daughter, Gabriella, or Gabi.
Just tell me what it is.
Yeah.
It's a stroke.
It's a stroke.
Yeah, it's a stroke. That's the diagnosis.
Yeah.
And the stroke has affected what we call the understanding and speaking component. So her speaking isn't so normal.
It's difficult. It's difficult.
Laura's CT scan has revealed a blood clot on her
I think
brain.
it's small stroke.
To reduce the risk of permanent brain damage, the stroke doctor is giving Laura's family the option of administering a clot-busting drug.
When somebody comes in so early on from the onset of a stroke, we have the ability to give a clot-busting drug. People who get it, compared to who don't, have far less disability a few months down the line. The disadvantage is the risks of bleeding. So although it's good to break down the clot, in this world you almost can't have something for nothing. The risks of bleeding are lower than the benefit. The risks of bleeding are around about a few percent. Low. Those people
The chance of developing serious side effects from the drug is less than 1%.
But there's no point. I can't say to you, it's all good. There's no problems. That's not fair. That's not the truth.
We only use one type of clot-busting drug, one type of thrombolysis drug at the moment. By giving those treatments, we hope that we can restore blood supply, thereby stopping any damage to brain cells. But there are downsides because you're filling the blood, and some patients will bleed into the brain, and you really do have to pick it for the right patients who do have sort of definite stroke pathology. More patients do better than do badly.
I just need to sorry, my head is just all over the place. So you've seen the scan and there's definitely a clot.
We know that because you can see the stroke symptoms. She was normal, regular tea coming up to bed. You don't have a huge amount of time to think about it, but have a few minutes to talk about it. Or do you want to ask me any questions?
You feel that you are hopeless, that really you cannot really decide. You're pushed to decide which way to go, but it's very, very, very difficult. Or you don't know if you make the right decision or the wrong decision.
Gabby, look at me. I've had such a good life.
It's not my God.
I have
She's
had
not dying. What?
such a good life. Don't cry. Please don't cry. Gabby. I'm not going anywhere. I'm not going anywhere. I don't want any risk.
You don't want any risk?
No, I don't want any risk.
Even if the benefits were more than the risks?
That would be up to my daughter.
Not
up to
both of them.
Both
together.
of them.
Yeah. Yes.
Before asking her family to make the final decision, a doctor will reassess Laura to see if there's been a change to her condition.
If you can hear and understand me, close your eyes. Put your left thumb on your right ear and relax. Point to somebody related to you. Okay. What is this?
A hand.
Close eyes tight, tight, tight. Open quickly. Show teeth. Open mouth. Stick tongue. Relax. So there's been a significant improvement.
Oh, yeah.
And so, just speaking about you, the speaking is better.
Yes.
Not perfect.
No,
you can see that.
No.
But we keep you in hospital still. We keep an eye on you.
Yeah.
We'll just every half an hour we'll check you to make sure that. Remember, I was talking about the clot busting drug for 4.5 hours. If it stays like this, it gets better. Great. If in the next few hours problems again, we'll have to rethink. Okay.
Yeah, about the drug.
Yeah.
Yeah.
I think that's right. I think that's the right thing to do.
Life is a chain. You cannot live forever. Someday something happens to anybody. You have to expect that when you get over a certain age. You have to accept that one day everybody has to die. And it's sad, but it's what is life.
I love you.
Yeah, I got you. a stroke. It's a warning for better look after yourself and to enjoy together life until long as possible, and then go.
Camillo won't let me do anything, apart from cook. He loves I'm the cook. They've got to let me be me, as I was before. I think I'm nearly there. I lose my speech occasionally. I don't lose my speech, I get tongue-tied. I could have another stroke at any time. What I want, see my grandchildren happily married. I just want my grandchildren to have a good life like I had. Because I can't complain about my life at all.